health is not a privilege. Every citizen in a modern society has a right to health care at an affordable price. Not only is the provision of health care the right thing for every government to do, but it's also important for society to have a healthy populace, which ensures a supply of healthy and productive workforce as well as consumers. We must invest in primary health care, in preventive health care. We must provide more health enlightenment for our people. In the 21st century, we should not have been woken up at 2 a.m. and be ordered by a text message of a known province to soak ourselves in salty water and to drink more than a pinch of it to fight a spreading virus. We must communicate better, certainly not through that channel. I hope that today's lecture and the discussions that will follow will enable us to come up with clear policy and governance directions for all stakeholders to buy in. We must agree on a minimum standard of care for our people, including how that will be paid for. Our approach ought to go beyond simply building hospitals and clinics, but to understanding the complex array of interconnected factors that affect health and well-being and the implications of an unhealthy populace for society as a whole. In my view, we need to identify the few illnesses that affect our people the most, what causes them, and how they can be prevented. We ought to then identify priority areas that would affect the largest number of our population and tailor our public health care policy accordingly. What role does poverty and inhospitable environment play in our people's well-being or lack of it thereof? Consider these facts that I'm going to give you. The 4 top killers of our people are malaria, HIV/AIDS, influenza, and pneumonia, and diarrhea-related illnesses. These 4 account for nearly 50% of all deaths in Nigeria, and they are largely preventable. Largely preventable. You can see then that a healthcare system that provides anti-malaria tablets to a patient who then goes back to the mosquito-infested slum and where she lives is not an effective one, is not. And it is also inadequate to provide antibiotics to a patient suffering from typhoid fever who then has to go back to drinking and washing with dirty, unhealthy water because of the absence of wholesome water in his neighborhood. We must also, as progressives, pay attention to simple health solutions that cost little to nothing to the public purse. For instance, are we doing enough to enlighten our people to the benefits of hygiene, such as simple, regular washing of hands with soap, which has been shown to significantly reduce the number of hospital visits by our people? Should we continue to have a healthcare system bereft of highly qualified and experienced medical professionals, while those we train at public expense continue to practice abroad, where they get better pay, work tools, and working conditions? Can we not come up with creative solutions in our states that will lure many of these professionals back to help improve our healthcare system and our people's lives? Where is our federal system? Therefore, a state or a number of states can introduce policies that make their states the place that doctors want to live and work in. I have repeatedly argued that there is no justification for workers everywhere in this country to earn the same salary. That is not federation at all. I know in the United States, where a governor earns about $40,000 per annum, And I also know of a state where a governor earns up to $200,000 per annum. It's a federal country. Lagos is not the same as Lokoja. Poti School is not the same as Port Harcourt. Yola is not the same as Yenogua. Besides, state governments that are able to generate more resources internally should be able to pay their workers more and provide more facilities. Would this not likely spur more competition among states and lead to overall improvement across the country? Yes or no? Is it not also not high time we establish real centers of excellence in healthcare in different zones of the country, such as state-of-the-art hospitals and health and disease control research centers? I believe that we have the resources. We just need the leadership. Not the kind of leadership that PDP provides. It is the kind of leadership that APC provides in their respective states. Ours are mostly governors of good or excellent example. We must continue to provide good examples for the rest of our country. Our people need them. Our country needs them because our country needs change. Thank you very much for listening. God bless you.
Please, another round of applause for His Excellency Alhaji Atiku Abubakar, GCON.